Knock, knock. Hi, my name is Emily. I'm going to be your nurse today. I'm going to go ahead and do a little assessment on you, and then we're going to go ahead and go through the doctor's orders and get any medication that he has ordered for you in ya, and hopefully get you feeling better, okay? Can you tell me your name and date of birth? All right, and can you tell me where you are today? All right. I'm going to go ahead and do an assessment on your arms, do a little neuro assessment on you to focus on that weakness that you're having and making sure that everything is going okay up there, all right? All right, so I'm going to go ahead and have you look to your left. I'm checking for some JVD. All right, awesome, no JVD present. I'm going to go ahead and take my pen light, and I want you to go ahead and follow it as I move it. And then I'm just going to be watching your eyes, okay? Okay, follow it as it moves backwards. And follow it as it moves forwards. Okay, what I'm checking here is just seeing how your pupils are. Are they dilating? Are they responding to the light? And I'm going to go ahead and just have you look forward for me. And I'm just checking to see if they constrict while the light shines in their eyes, okay? All right, I'm going to have you go ahead and just relax. I'm going to feel your arms. All right, are you having any pain in these arms? Okay, I'm going to have you go ahead and push down on my arms and pull up on my arms. All right, and then I'm going to just go ahead and have you grab my hands. What I'm doing is crossing my arms because it gives me a more distinct whether or not which way is either grabbing me tighter, if they're both equal, or if one is weaker. And she does have some more weakness on her left side than she does her right. I'm going to go ahead and have you pull up your arm. Does that hurt when you pull up your arm? No? Okay, it's just kind of weak. Are you having any pain in your stomach or anything like that? Okay, I'm going to go ahead and just take a listen to your lungs and your heart. I'm going to do 8 on the front and 7 or 10 on the back. Okay, go ahead and sit up for me. I'm just going to check your back. All right, go ahead and take a sit back. All right, can you go ahead and smile for me? And go ahead and stick your tongue out for me. By smiling is just showing if she has the muscle in her face. She does have some drooping on her left side, so her face isn't completely symmetrical. That would show some signs of having her stroke. Smiling is showing her tongue, just also giving another indicator of how she is moving those muscles. All right, I'm just going to go ahead and listen to your stomach. All right, you've got bowel sounds times 4. Your lung sounds are clear, and you do have some diminished heart sounds, okay? That didn't hurt when I went ahead and felt your stomach. All right, good. So I'm going to go ahead and just feel down your legs, again, checking for some edema. I would also check her cap refill on her fingers, so I would just rewash my hands since I touched her legs already, and check for that cap refill, which is less than 3 seconds. Okay, so I'm going to go ahead and have you push up on my hands and pull down. All right, I'm going to go ahead and check that cap refill again. It's less than 3 seconds, which is good. Are you having any pain in your lower extremities? No? Okay. She doesn't have any pitting edema in her arms or her legs. Okay, I'm going to go ahead and go look at the doctor's orders, see what he's got us, and get you prepped for any type of labs or diagnostic tests that he would like us to perform, okay? And then if he does have some orders in there for us, I'm going to go ahead and bring them back, and we're going to get them started, okay? All right, thank you. Knock, knock. Hi, I'm Emily. I'm back. I did get some orders from the doctor. We're going to go ahead and do some oral suctioning on you, and you're also going to get some TPN, we're going to get you some, let's see what he has on this order for you, okay? We're going to give you some TPA IV piggyback, okay? And we're going to get you 0.9 milligrams per kilogram, okay? And we're going to infuse that over every hour. Okay, so I'm going to go ahead and get all my supplies that I need for your oral suctioning. And basically all I'm going to need is a suctioning tube. Make sure that it is hooked up to the canister on the wall. And what I'm going to do is have her open up her mouth. I'm going to put the suction in. Make sure to keep it going in circles. Never let it hold down on one portion of the mouth. Okay, and I'm going to suction until nothing really comes out. I want to document the date, the time, how much I suctioned, the color, the amount, and the consistency, and how the patient tolerated it. After I'm done suctioning, I'm going to make sure to look in her nares. And I'm also going to look into her mouth to make sure it didn't do any damage. Okay, and I've drawn out 15 milliliters of suction. And then I'm going to make sure to unhook the suction from the wall. All right, so I'm going to go ahead and get your supplies ready to do your IV piggyback. So supplies I'm going to need are gloves, an alcohol swab, and my IV piggyback medication and my secondary tubing. I already have primary tubing hooked up with a medication hooked to it, 0.9 normal saline. So what I'm going to do is I want to make sure that my roller clamp is clamped. Okay, I want to clamp, or make sure that it is clamped. I'm going to take my medication. I'm going to spike my medication bag. I would take my primary bag that is already hooked up, and I would make sure that it is on the blue hook that comes in the IV, secondary IV tubing bag, which I don't have, and I would hook that on there to make sure it is lower than the medication that I'm going to hook up currently. So after I spike the bag, I want to hook this on my pole. I would make sure that the patient's name, the amount, the date, the time that it was started. I would also make sure to double check any drug allergies that this patient has. I would check their ID band and ask their name, date of birth, and match it with my MAR. Okay, so since I have already done that, I'm going to hook this on my tubing. I'm going to take my secondary tubing. I want to hook it to the furthest port on the primary tubing away from the patient. I would take an alcohol swab and make sure to clean that port because it has been exposed to air. It is no longer sterile. I'm going to hook it on. I'm going to squeeze my chamber to fill up with some solution. I'm going to, once it's hooked, unclamp my roller clamp, and I want to hold this secondary tubing below the primary tubing bag to do a backflow. To prime this tubing. Once it is, then I'm going to hang it up and allow it to flow. Okay, I'm going to allow this to flow for 1 hour, and I'm going to make sure to come back and check every 15 minutes while it is running to look at their vital signs and do a neuro check. Okay. So since all of your medication is administered, we're just going to kind of go over what's in your chart so you understand what is going on. And if you have any questions, we can go over those questions and get those answered for you, okay? So when you came in, you having a new onset of AFib, rapid ventricular response, and you also had a cardiac telemetry unit, and we got you back to normal sinus rhythm. We were given a calcium channel blocker, and we had gotten you stable, okay? So when you first got in here, since you don't really remember, we did an EKG. We did that same exact assessment that I just did on you. We did that as well. So we had you smile, stick out your tongue. We did have you push and pull on our hands. We did check your eyes, and we did a full set of vitals. And those vitals were 100.4 for your temperature. Your pulse was 99. Your respirations were 24. Your blood pressure was 146/83. And you were 89% room air. So we did give you some oxygen. Okay, you also had some left-sided drooping, some slurred speech, and you weren't able to lift that arm for more than 3 seconds. So we did sit you up into the semi-Fowler's position. We did some cardiac assessments on you, and we did call a stroke alert. Okay, and you were having a stroke on your right side, which caused you to experience all this left-sided complications. So we did give you some suction, and the neurologist was at your bedside in 7 minutes. So your stroke scale score was 32, so we got you a stat CT scan, but there was nothing in your brain that showed a brain bleed. So some possible medications that we could have given you were some anticoagulant therapy, some antiplatelets, some medication to control your blood pressure, some thrombolytics. We gave you some oxygen to bring up your O2 stat, which was only 89, and we put you in the semi-Fowler's position. So some contraindications to the thrombolytics, like the PTA that I just gave you, some IV push. We can't give it to you if you've had a head trauma or a stroke in the last 3 months, any uncontrolled hypertension, active internal bleeding, which with the CT scan it showed that it did not have it, an intracranial pressure or intracranial neoplasm or aneurysm, which you didn't have any, and you are not pregnant, so we were able to give you that today. So we're, again, going to continue over the next hour giving you some vital signs and neurochecks every 15 minutes. Also, we want to monitor any bleeding, and some complications could be some bleeding as well. Okay, so I'm going to go ahead and let you rest for a little bit. Since your medication is infusing, I'll be in every 15 minutes to do, again, those checks. And then after that hour, we'll go ahead and come back in and do another assessment on you, okay? All right. All right, knock, knock. All right, this is our last 15-minute check, okay? So I'm going to go ahead, do your vital signs again, and do a neuro check. And then we're going to go ahead and since you're improving and you're able to do some more clearing of your speech and your weakness has gotten better, we're going to go ahead and get you some discharge in about 2 days after we continue to monitor you, okay? And once all that is monitored and you are fully recovering, we can go ahead and send you home, okay? So since I'm done with that check, I'll be back in about an hour and a half or so, and we will do another assessment on you and make sure everything's getting better, okay? All right. All right, knock, knock. Hi, my name is Emily. I'm still your nurse today, okay? So it's been about 2 hours since your infusion. It seems to be that you are speaking better. You're having some less weakness on your arms. I'm just going to go ahead and do another little neural assessment on you to make sure everything's checking out. And then we will get your discharge papers going and you can get ready to go home in the next couple days, okay? Alrighty. So I'm going to go ahead and take my pin light again. I'm just going to shine it. I'm going to have you follow it and all that stuff. So I'm just going to have you follow it. Okay. Follow it backwards and follow it forward. Okay, I'm just going to take a look in your eyes. Just go ahead and look forward. Awesome. I'm going to have you go ahead and stick out your tongue. I'm going to have you smile. And can you tell me a little bit of a sentence? All right. I'm going to have you go ahead and push on my hands and pull up on my hands. All right. And go ahead and grab my hands. All right. Awesome. All right. So I'm going to go ahead and just let you be for the rest of the day. If you have any more complications or anything like that, let me know. But right now, we don't have any type of medication to give you, so I'm going to let you rest and just keep checking in on you to make sure everything's okay, all right? If you get any symptoms or anything that are unusual, go ahead and push that call light, and I'll be right in, okay? All right, thank you. Hello. I see you have your call light on. Is there something that I can help you with? Okay, so your daughter just has a question. So your daughter's question is asking why this happened. So what had happened was an ischemic stroke. And what an ischemic stroke is when you have, if you're resting or sleeping and you have a decrease in blood pressure that occurs, it can go ahead and take a clot that has been in there and it can travel. So what has happened is you've had a clot break off and it's traveled to your brain. Also, because of your new AFib, there was some blood pooling in your atria, and it can cause clots to form. And when those clots form, again, when that blood pressure drops, they could cause those clots to break off and go ahead and travel. So what happens is when you got back to your normal blood pressure, those clots had broken off and they had traveled up to your brain and causing this stroke, okay? So there is a full recovery expected for you. We're going to go ahead, since you've been in here for about 2 days now, we're going to go ahead and give you some discharge instructions today, and you'll be able to go home. We're going to give you some clopidogrel and aspirin, and also a calcium channel blocker, okay? And then we're going to also have you come back in about a week to see the neurologist and do another checkup with your neurostatus, okay? So we want to make sure that you are taking your medications correctly. You're not doubling them up or skipping any doses. We want you to know that you need to call the healthcare provider or call 911 if you're starting to have any more of those signs and symptoms of a stroke that you had. Making sure that you're complying with your follow-up appointments. And then we will give you a little pamphlet on signs and symptoms of other strokes and signs and symptoms of your AFib, okay? So that's all I have for you today. I will be back in about a half hour or so with the doctor, and we'll talk to you about all the lovely things that you need for you to go home. And then after that, you will be all set to leave, okay? All right, let me know if you have any other issues, okay? Thank you.